Tinea Cruris or Jock itch is a fungal infection that causes a red scaly and itchy rash in warm moist areas of the body. The rash often affects the groin, the inner thighs, and is usually shaped like a ring. Jock itch gets his name because it's common in athletes. It's also common in people who sweat a lot or who are overweight, although often uncomfortable and bothersome. Jock itch is a very common condition and usually isn't serious, but keeping that in mind, never ignore any disease and always seek medical help at the earliest. Hence, it is very important to treat it at an early stage, because if not rated in the early stages, it becomes very difficult to treat later on, as the topical drugs that are used for the treatment of normal fungal infections of the skin fail to act effectively at later stages of the disease. Hey viewers, I'm Dr. Sophia Fahl and welcome to Lovers of Good Health channel. In today's video, we will be talking about Tinea Cruris, better known as Jock itch. But before we begin, kindly use some of the time to subscribe to this lovely channel and leave us a like on this video to support the channel. Thanks for doing that. Now let's begin. Fungi thrive in warm, moist environments. So this type of environment can cause them to naturally overpopulate. The same fungi that cause nail infections, athlete's foot, and drink worm can cause Jock itch. These belong to a group of fungi known as the dermatophytes. Trichophyton is the most common dermatophyte involved in Jock itch. Other dermatophytes that may be involved are epidermophyton and microsperm. Before we get into how to treat Jock itch, let's first look at some of the factors that increase your risk of getting Jock itch. Jock itch is especially common in summers and rainy seasons because this leads to increased sweating and temperature, which are ideal conditions for the fungi to grow. If you wear tight-fitting and synthetic clothes that occlude your body and prevent air circulation, this also increases the risk of getting these fungal infections. Sharing towels or personal clothes with other people can also increase your risk. Personal hygiene is very important, and habits like not bathing regularly and not breathing after strenuous workout sessions or exercise also increases the risk of getting these fungal infections. If you have untreated fungal infections at other parts of your body, the fungi can spread from those areas to the groin and cause an infection. Having a weak immune system or diabetes also increases your risk of getting Jock itch. Now let's talk about how Jock itch or Tinea presents and what symptoms you can develop. Jock itch is typically found in the groin, inner thighs, or the anal region. Also, it can be located on the lower abdominal area. Symptoms include itching and burning, a red scaly circular rash with raised edges, scaling, flaking, or peeling of skin in the infected region. The rash usually begins with a reddish area of skin in the crease of the groin. It often spreads to the upper thigh in a half-moon shape. The rash is usually ring-shaped and can also have small blisters. It may burn or feel itchy, and the skin may be flaky or scaly. If you visit a dermatologist, they can confirm the diagnosis by performing a few simple tests. The first basic test usually done is skin scraping test. The doctor scrapes the edges of the rash and observes it under the microscope to check for the presence of fungi. These skin scrapings can also be sent for fungal culture test. In most cases, the dermatologists can easily identify Jock itch, and they can promptly start the treatment without any tests. Now, let's look at some lifestyle modifications you can implement that will help you to prevent Jock itch. In the first place, keep your groin area dry. Dry your genital area and inner thighs thoroughly with a clean towel after showering or exercising. Also remember to dry your feet after taking a bath. Wear clean clothes. Change your underwear at least once a day or more often if you sweat a lot. Undergarments made of cotton or other fabrics that absorb moisture and keep the skin dry also help to prevent this infection. Always remember to wash your workout clothes after each use. Make sure your clothes fit correctly, especially your undergarments. Avoid tight-fitting clothes, which can rub and irritate your skin, and put you at an increased risk of jock itch. Try wearing boxer shorts rather than briefs. Don't share personal items. Don't let others use your clothing, dolls, or other personal items. Also, don't borrow such items from others. Control any athlete's foot infection to prevent its spread to the groin area. Now, if we look at the treatment itself, it can be divided into topical antifungals, which are applied over the skin, and oral medication. Topical medications include soaps, body washes, lotions, creams, and gels. We will look at them one by one and see which one is best for you. Topical antifungals are the first line of treatment for the patients of chocolate. The most effective topical antifungals include drugs like azoles, which include chloramazole, ketoconazole, oxaconazole, and ceticonazole. Another very effective category of drugs are allylamines like terbinafine and butanafine. And there are some newer antifungal drugs also like cyclopyrax and selenium sulfide, which are proving to be very effective for the treatment of jock itch. You can start the treatment with a soap or body wash containing clotrimazole, 1%, or ketoconazole, 2%, and use that to wash your body every day. When you apply the soap or the body wash, make sure to leave it on for a few minutes before you wash it off so as to have the maximum antifungal effect. You can also use cyclopyraxolamine or selenium sulfide body washes. Next, we move on to the antifungal creams, gels, or lotions you should use. Again, similar antifungal drugs are present in these creams and lotions like ketoconazole 2%, chloramus all 1%, laliconazole 1%, ibuconazole or ceticonazole, selenium sulfide 2.5 lotion, and cyclopyrax 1% cream are also very effective. You should apply these creams and lotions twice daily, once in the morning and once before sleeping. As per my experience as a dermatologist, I have found Lalal 1% cream, selenium sulfide, and cyclopyraxolamine creams to be quite effective in the treatment of jock itch. The treatment with these topical drugs should be continued for a minimum of 4 weeks if you have a mild infection. And if you have a severe infection involving larger areas of the groin, upper thighs or abdomen, you should continue the topical treatment for at least 6 to 8 weeks. Oral antifungal drugs are indicated in the case of extensive involvement of the skin and in patients who fail to respond to the topical therapy such as creams and lotions. Now there are 3 main FDA-approved antifungal drugs for the treatment of teenagers. These are terbinafine, itraconazole, and fluconazole. These drugs act by inhibiting certain enzymes in the fungi that are important for the fungi to synthesize their cell wall. Without a proper cell wall, these fungi cannot grow, and they soon die out. Out of these 3, fluconazole is mainly indicated for the treatment of vaginal candidiasis, oropharyngeal, and esophageal candidiasis, while itraconazole and terbinafine are mainly used for the treatment of tinea, and we will focus on them. Itraconazole is available in 100 mg, 200 mg, and 400 mg doses. 14-year Cruris is usually 100 mg twice a day, or 200 mg once a day for 2 weeks is the minimum you should take this drug. Terbinafine is given as 250 mg tablet daily for 2 to 4 weeks. These drugs are usually not available over the counter, so you need a prescription from a dermatologist. While undergoing this treatment, make sure to take proper care of your hygiene and wash your clothes regularly with hot water. Also make sure to iron your undergarments before each use, as many of the times these fungal spores can get deposited on our innerwear clothes. And this can cause frequent relapses and treatment failures. So that was all about jock itch and its treatment. Make sure to subscribe and hit the bell icon so you don't miss out on our videos. Thank you so much for watching. If you found this video helpful, make sure to like this video and also share with someone who you think might find it useful. Bye bye and see you in the next video. Some sources say that around 60 to 70% of people will experience hemorrhoids at one point or another in their lives. And an estimated 1 in 20 Americans have symptomatic hemorrhoids. Hemorrhoids affect people of all ages, genders, races, and ethnicities, and they also get more common as you age, affecting more than half of people over the age of 50. Hey viewers, I'm Dr. Sophia Fahl and welcome to Lovers of Good Health channel. In today's video, I will be talking about hemorrhoids, commonly known as piles, which is a very common painful and irritating disorder. But before we begin, kindly use some of the time to subscribe to this lovely channel and leave us a like on this video to support the channel. Thanks for doing that. Now let's begin. So let's first try to understand what actually are these hemorrhoids. Well, our rectum and anus have a rich supply of blood vessels, and sometimes due to certain reasons, which we will discuss further in this video, these veins get swollen and enlarged. These fallen and large veins that form inside and outside the anus and rectum are termed as hemorrhoids. They can be painful, uncomfortable, and can even cause bleeding. Hemorrhoids can happen inside or outside the rectum. The type depends on where the swollen veins develop. Based on this information, they can be internal, external, or prolapsed. Hemorrhoids in external piles, the swollen veins form underneath the skin around the anus. External hemorrhoids can be itchy and painful. Occasionally they might bleed, sometimes they fill with blood and they can clot. Also, although this is not dangerous, but it can result in a lot of pain, swelling, and discomfort. Internal hemorrhoids consist of swollen veins that form inside the rectum. Your rectum is the part of the digestive system that connects the colon or the large intestine to the anus. Internal hemorrhoids may bleed, but they are usually not painful. Both internal and external hemorrhoids can prolapse, meaning they can stretch and bulge outside the anus. You may feel a mass coming out of your anus and causing discomfort just as the previous ones. These hemorrhoids may also bleed and cause pain. So, who are at a higher risk of developing hemorrhoids? Basically anyone can get symptomatic hemorrhoids, even teenagers. You may be at a higher risk if you are overweight or obese. Pregnancy is also a risk factor for developing hemorrhoids. Poor dietary choices like eating a low-fiber, high-carb diet can lead to chronic constipation, which is a very common risk factor for hemorrhoids. Habits like lifting heavy objects, spending a lot of time sitting on the toilet, and straining while having bowel movements can also lead to development of hemorrhoids. Now let's talk about the signs and symptoms of hemorrhoids. Internal hemorrhoids rarely cause pain and typically can't be felt unless they prolapse. Many people with internal hemorrhoids don't even know they have them because they don't have symptoms. However, if you have symptomatic internal hemorrhoids, you might see blood on the toilet paper, in the stools, or the toilet bowl. These are signs of rectal bleeding in case of external hemorrhoids. Symptoms may include an itchy anal area, hard lumps near the anus that feels sore, or tender pain in the anal region, especially when you sit. And rectal bleeding. Prolapse hemorrhoids can be painful. You may be able to feel them bulging outside the anus. Hemorrhoids can be uncomfortable and painful, but they don't tend to cause serious problems. Rarely people with hemorrhoids can develop anemia, blood clots in the external hemorrhoids, infections in the hemorrhoids, and they can also develop skin tags in the anal region. Your doctor can diagnose hemorrhoids based upon symptoms and a physical examination. Some simple tests can also be done, like digital rectal examination, in which your doctor inserts a gloved, lubricated finger into the rectum to feel for swollen veins. This helps in diagnosing the location and also testing the effectiveness of the current treatment. Anoscopy procedure can also be done, in which your doctor uses an anoscope. which is basically a lighted tube to view the lining of the anus and the rectum. Sigmoidoscopy, or colonoscopy, are advanced procedures in which your doctor uses a sigmoidoscope or a colonoscope, which are basically lighted tubes with a camera that help to view the inside of the lower part of colon and rectum. These tests may be uncomfortable, but they aren't painful. They typically take place in the doctor's office or outpatient center. Without anesthesia, you can also go home on the same day. They are important because these tests help your doctor to rule out dangerous problems mimicking hemorrhoids like cancers and inflammatory bowel diseases. Hemorrhoids often go away on their own without treatment. Symptoms like pain and bleeding may last 1 week or slightly longer. In the meantime, you can take these simple steps to ease symptoms and reduce the pain. You can apply over-the-counter medications containing lidocaine or hydrocortisone to the affected area, which helps in decreasing the pain. Drinking 2 to 3 liters of water every day helps in keeping the stool soft and prevents constipation. Similarly, increasing your fiber intake is one of the most important things you can do to treat hemorrhoids. Eat more fruits, vegetables, and whole grains. Doing so softens the soles and increases its bulk. You can also take a fiber supplement to get 20 to 30 grams of fiber per day. To start, try a psyllium husk fiber supplement. If psyllium causes gas or bloating, try a supplement containing wheat dextrin or methylcellulose. Sitz baths are very helpful for decreasing the symptoms of hemorrhoids. In a sitz bath, you soak the inflamed area in water for about 10 to 15 minutes for 2 to 3 times a day. If you have chronic constipation, you can also try some laxatives to soften the stools. You can also take some over-the-counter pain relievers like acetaminophen, aspirin, or ibuprofen to get relief from the pain associated with hemorrhoids. Don't sit too long or push too hard when you pass stools. Go to the toilet when the urge hits and don't delay bowel movements. Use toilet paper with lotion or flushable wet wipes to gently pat and clean your bottom after passing stools. This will provide comfort to your anal region and prevent any damage caused by rubbing. You can also use some topical treatments like over-the-counter hemorrhoid creams or suppositories containing hydrocortisone. Also, numbing agents like lignocaine gels may help in managing the irritation caused by hemorrhoids. You should consult your doctor if symptoms get worse or interfere with your daily life or sleep. Also, seek help if signs don't improve after a week of at-home treatments. If your issue still doesn't get resolved or some complications develop. Advanced procedures to treat hemorrhoids can be done like rubber band ligation, electrocoagulation, infrared coagulation, or sclerotherapy. Also, last resort surgical treatments include hemorrhoidectomy and hemorrhoid stapling. So I hope this short video was helpful and you gained some knowledge regarding this condition and how to manage it. Thank you so much for watching and see you in the next video. Let's first try to understand why do people snore. Well, if you snore, you're not alone. According to studies, up to half of all American adults snore. When we sleep, muscles and tissues in our throat relax and become floppy, so when air flows through our throat during our sleep, vibrations are produced. This causes the harsh and irritating snoring sounds we all know and hate too. Snoring may disrupt your sleep, or that of your partner. Even if it's not bothering you too much, it's not a condition you should ignore. In fact, snoring may be a sign of a serious health condition, including obstructive sleep apnea, which basically means blocked airways, obesity, an issue with the structure of your mouth, nose, or throat, or chronic sleep deprivation. However, in other cases, snoring may be caused simply by sleeping on your back or drinking alcohol too close to bedtime. In some cases of snoring, it's important to seek a doctor's care. In order to get the medical treatment, you need to address the underlying condition. but there are certain simple remedies to control snoring which we will discuss in this video. Hey viewers! I'm Dr. Sophia Fahl and welcome to Lovers of Good Health channel. In today's video, we will take a look at few remedies for a common problem that is snoring. But before we begin, kindly use some of the time to subscribe to this lovely channel and leave us a like on this video to support the channel. Thanks for doing that. Now let's begin. The number one remedy to stop snoring is to lose weight. Losing weight directly helps in reducing snoring. This happens because shedding weight will not only improve your health, but it directly reduces the amount of excess tissue in the throat, the same tissue that creates the irritating snoring sounds. So you can begin to lose weight by reducing your overall caloric intake. Also, you can switch to eating smaller portions of food at regular intervals and creating a diet composed of more healthy and nutritious foods. Including fruits and vegetables. Also make sure that you get regular exercise every day. You may also consider consulting your doctor or a nutritionist for getting professional advice to manage your diet and weight effectively. Number 2 is to sleep on your side. When we sleep on our backs, sometimes the tongue moves to the back of the throat. This partially blocks the usual airflow through your throat, leading to snoring. Sleeping on your side may be all you need to do to allow air to flow easily and reduce or stop your snoring. Number 3. Raise the head end of your bed. Elevating the head end of your bed by 4 inches can help to reduce snoring by keeping your airways open during sleep time. It will also improve your oxygen levels. Number 4 is to use nasal strips or an external laser dilator. Stick-on nasal strips are easily available in the markets. Today you can either buy them online or go to a nearby pharmacy to get them. Nasal strips work on a simple concept. They are placed on the bridge of the nose and they increase the space in the nasal passage. This can make your breathing more effective and reduce or eliminate your snoring. You could also try a nasal dilator, which is an adhesive tape that's applied on the top of the nose across the nose rails. This can decrease airflow resistance, making it easier to breathe. You can try these nasal strips to help reduce snoring. Number 5. Manage your chronic allergies more effectively. Allergies lead to swelling inside your airways. This can reduce airflow through your nose, which forces you to breathe through your mouth. This increases the likelihood that you will snore. Talk to your doctor about what kind of over-the-counter prescription allergy medications you may get to improve your condition. Number 6. Limit or avoid alcohol before bed. Numerous studies have shown that alcohol intake before bed can lead to increased relaxation of throat muscles, which in turn causes snoring, so try not to consume alcohol for at least 2 hours leading up to your bedtime. This simple small habit goes a long way to help you lead a healthy life. Number 7. Stop smoking. Smoking is an unhealthy habit. Studies after studies have shown the widespread destructive effect the smoking causes in our body. This is no exception. Not only you are more likely to snore, but you are more likely to experience episodes of apnea if you smoke. So quitting smoking is the best option for you. Trying nicotine gums in patches can be effective methods also. Consult your doctor or therapist to effectively manage your cravings. Number 8. Get enough sleep. Daytime sleepiness, excess tiredness, and incomplete sleep can all exacerbate your snoring symptoms. Make sure you get the recommended 7 to 8 hours of sleep you need each night. Your body will respond positively to the adequate rest, and you will definitely feel an improvement in reducing snoring. Number 9. Use an oral appliance. Dental mold pieces called oral appliances are also a popular method of controlling snoring. They also work on the same principle by keeping your air passages open. They make it easier for you to breathe, which basically prevents snoring. but you need to consult your dentist to get one of these devices. Number 10. Medical interventions. Usually in most cases snoring resolves with lifestyle changes and above said methods like weight loss, but in some cases snoring causes breathing problems. To prevent that, your doctor might advise you few medical interventions. These are usually reserved as a last resort. These may include using a CPAP machine, which is short for continuous positive airway pressure. If medically appropriate, wearing a pressurized air mask over your nose when you sleep can help keep your airway open. Patients are recommended to keep the mask on for their whole period of sleep. This treatment is often recommended to treat patients who have breathing difficulties associated with snoring, also known as obstructive sleep apnea. This is most commonly used medical intervention and is effective for most patients. Palatal implants, also known as pillar procedure, is a treatment that involves injecting braided strands of polyester filament into your mouth's soft palate. This stiffens it to reduce snoring. Snoring can disrupt your sleep and that of your partner. But besides being annoying, it may indicate a serious health condition. Consulting your doctor and trying one or more of these above treatment options can help you get your sleep under control. Do consider leaving a like and sharing this video. We at Lovers of Good Health are committed to bringing you the latest and updated content every time. If you would like to support us, consider subscribing and becoming a member of our channel on YouTube. Thank you so much, and see you in the next video. Our lungs are one of the most important organs of our body, performing the vital function of delivering oxygen to our blood, which is a lifeline of every cell in our body. However, lungs are among the organs which are constantly exposed to the outside environment and its pollutants. Breathing in air pollution, cigarette smoke, and other toxins can damage the lungs and even cause serious health conditions. The cigarette smoke settles on the bronchial tubes and air sacs, causing a decrease in breathing capacity. And inhaled carbon monoxide disrupts the body's oxygenation. To give you an estimate of the burden of disease. Hey viewers, I'm Dr. Sophia Fahl and welcome to Lovers of Good Health channel. In today's video, we are going to talk about how you can detoxify your lungs and keep them healthy. But before we begin, kindly use some of the time to subscribe to this lovely channel and leave us a like on this video to support the channel. Thanks for doing that. Now let's begin. Cigarette smoking is responsible for more than 480,000 deaths per year in the United States alone, including more than 41,000 deaths resulting from secondhand smoke exposure. This is about 1 in 5 deaths annually, or 1,300 deaths per day according to the World Health Organization. Exposure to air pollution results in 4.2 million deaths worldwide each year. Now, lung detoxification techniques can benefit people who smoke, people who get regular exposure to air pollution, and those with chronic conditions that affect the respiratory system. Diseases like asthma, chronic obstructive pulmonary disease, or cystic fibrosis. So in this video, we will be talking about how you can protect your lungs from further damage and methods you could use to detoxify your lungs. Then we will look at some of the foods and supplements you can include in your diet to keep your lungs healthy. The number one thing that we have in our list, which is to protect your lungs from any further damage. While you can't entirely undo years of damage from sacred smoking, the best thing you can do to detox is to protect your lungs from any further damage. The most important thing smokers can do in this regard is to obviously stop smoking altogether. Now I know for most of the smokers it can be an impossible task, but you can always try. There are plenty of resources available on the internet for smoking the addiction. Nevertheless, if you're not planning on quitting anytime soon, what you can do is reduce your frequency of smoking. That is very important for non-smokers. It is also very important to avoid secondhand smoke. While quitting smoking is the most important thing you can do for your lungs, it's crucial not to breathe in other people's smoke as well. Use face masks in places where there is high level of air pollution. The air passages in our lungs have microscopic finger-like projections on them known as cilia. The cilia and sticky mucus work together to protect the lungs from infection. The mucus traps any bacteria or pathogens as they enter the lungs, and the cilia move in a synchronized pattern to move the mucus up into the airway back into our throat, where it can be swallowed. And any pathogens can be killed by the acidity of the stomach. If we are smoking constantly, or we are getting exposed to high levels of air pollution, the cilia in our lungs do not function properly, and they are unable to clear our lungs from various particles in the smoke, as well as bacteria and other pathogens. So if you want to detoxify our lungs and implement the other methods we are going to talk about next in this video, it is very important first that we reduce our exposure to smoke and other forms of pollution. This allows our cilia to function properly and help in the recovery of lungs in a much better way. The second thing to do is to control your indoor air pollution. Indoor air quality also contributes to lung diseases. Dust, irritants, and chemicals can build up in your home. People with lung diseases usually spend a lot of time indoors, and it's important to do so on days when outdoor air quality is poor. Here are a few suggestions to help improve the indoor air quality. Clean up vacuum oftenly and invest in a good quality vacuum cleaner. Mop your floors, but try not to use chemical-laden cleaners. Dehumidify your rooms. Dust and mold grow very quickly in a humid environment. Use a dehumidifier or keep your exhaust fan running while cooking to prevent the growth of mold. Test for radon gas. Radon is a radioactive gas occurring naturally in the ground, and it contributes to lung cancer. It can get in your home from the foundation. Pick up a radon test kit at any home improvement store. Go chemical-free, use natural cleaning products, fragrance-free products, and avoid aerosol sprays. Purify the air inside your home. Indoor plants, such as fern spider or aloe vera, can help purify air. You can also use an air purifier. So these were the first two things in our list: cutting down or completely avoiding smoking and avoiding outdoor air pollution, and cutting down the levels of indoor air pollution. Now let's talk about the ways you can detox your lungs. These include postural drainage, proper diet, and exercise. Let's talk about them one by one. So the number one thing is postural drainage. Postural drainage is the drainage of lung secretions using gravity. In postural drainage, the patient's body is positioned so that the trachea is inclined downwards. Frames, tilt, tables, and pillows may be used to support patients in these positions. Here are some techniques to perform personal drainage. The first position is done by lying on your back. Lie down on the floor or a bed. Place pillows under the hips to ensure that the chest is lower than the hips. Then slowly inhale through your nose and exhale through your mouth. Each exhale should be taken twice as long as the inhale, which is called 1 to 2 breathing. This should be continued for a few minutes. The second position will be performed by lying on your side. Lie on one side, resting the head on an arm or a pillow. Place pillows under the hip and practice the 1 to 2 breathing pattern. Continue for a few minutes and then repeat on the other side. The third position will be done by lying on your stomach. Place a stack of pillows on the floor and lie down with the stomach over the pillows. Remember to keep the hips above the chest. Fold the arms under the head for support. Practice 1 to 2 breathing pattern and continue for a few minutes. Postural drainage relies on the effect of gravity to drain the secretions from one or more lung segments into the central airways, where it can be removed by huffing or light cuffing techniques. Each position is usually held for 10 minutes, and these should be done for 4 to 5 days per week. Do these positions in the morning to clear mucus that's been built up overnight, or right before bed to prevent coughing during the night. Avoid doing postural drainage after the meals. So this was about postural drainage. The next important thing that you can do to detox your lungs is exercise. Just like regular exercise makes your muscles stronger, it also makes your lungs and heart stronger. Now, exercises for lungs can be divided into 2 types. The first one is your regular cardio and aerobic exercises, which include jogging, cycling, swimming, or any sport that pumps up your heart. Choose what suits you the best and perform at least 30 to 40 minutes of these exercises 5 times per week. Cardio and aerobic exercises are very good for lung health because when you perform these exercises, the blood flow in your pulmonary vessels increases many folds. This helps to heal the damaged tissue of our lungs and helps in the overall process of lung detoxification. The second type of exercises you can do for better lung health are breathing exercises. Breathing exercises help to improve the lung function and lung capacity as well, especially for individuals who are smokers, who have smoked in the past, or who have lung damage from a chronic lung disease. Now, there are many types of breathing exercises, for example, diaphragmatic breathing, burst lip breathing, etc. So, this was about the exercises you should do to help to recover your lungs to a healthy state. Now let's talk about some of the things you should include in your diet for lung detox. Number 1 is green tea. Green tea contains many antioxidants that help to reduce inflammation in the lungs. These compounds may even protect the lung tissue from the harmful effects of smoke inhalation. A recent study involving more than 1,000 adults in Korea reported that people who drank at least 2 cups of green tea per day had better lung function than those who drank none. You can also include vitamin D in your diet. A vitamin D-rich diet also improves your lung health. The best food sources of vitamin D are usually animal products such as salmon, sardines, eggs, milk, butter, etc. Make sure to give 10 to 20 minutes of exposure to sunlight per day, so that the vitamin in your body could be converted into its active form. You should also include antioxidant foods in your diet. Nutrient-dense foods, especially those abundant in antioxidants, are well known for helping the lungs recover to their optimal health. Antioxidant-rich diet helps to neutralize the free radicals that damage the lung cells. Thus, it is very important to consume foods that are packed with antioxidants to promote overall lung health. Some of these foods include apples, which contain a variety of phytochemicals including quercetin, catechin, fluorescein, and chlorogenic acid, all of which are strong antioxidants. Red bell peppers also contain abundant antioxidants, vitamin C, and carotenoids. Turmeric and its powerful ingredient curcumin have powerful antioxidant health benefits as well. Blueberries are believed to have one of the highest antioxidant levels of all common fruits and vegetables. The main antioxidant compounds in blueberries are known as flavonoids. Some other very good foods that have abundant antioxidants include green leafy vegetables, lentils, beans, grapes, walnuts, and garlic. So these are some of the foods that you should include in your diet that will help in your lung detox process. You can also consider taking antioxidant supplementation. I hope you liked the video. If you did, support us by hitting the like button below. Thank you so much for watching this video. See you in the next one.